Hello and welcome back to the PJ Pod. In this Spotlight episode, we'll be discussing our latest analysis of MPharm awarding gap data. Longtime PJ readers will know that this is a story we've followed since 2020, when we became the first publication to raise awareness of an ethnicity awarding gap within the MPharm program as part of our PJ's Mind the Gap campaign. Since then, our team of journalists has diligently assessed the gap to monitor progress with making the MPharm a fairer, more inclusive program for all students. This month in the PJ, Senior Features Editor Dawn Connelly analyzed data provided to us from the Higher Education Statistics Agency, or HESA, on MPharm degrees awarded by pharmacy schools in 2021-22 and 2022-23, which is the most recent data available. She's joining me for this episode to talk about her findings. Hi, Dawn.
Hello.
Okay, let's start with the basics. What exactly is the ethnicity awarding gap, and why should we be concerned about it in pharmacy education?
Okay, so the ethnicity awarding gap refers to the difference in the percentage of white and minority ethnic students awarded a good degree classification. So that's a first or a 2-1. In pharmacy education, this matters a lot because those higher classifications often influence access to competitive job roles and further study opportunities. An unfair gap here risks limiting career prospects for ethnic minority graduates, which affects diversity in the pharmacy profession as a whole and ultimately impacts patient care.
Talk us through your key findings from the HESA data this year.
So I analysed data from almost 4,600 students who graduated with an MPharm degree from 28 of the 30 schools of pharmacy in the academic years 2021-22 and 2022-23. The main thing that jumped out is that after narrowing to 8 percentage points during the pandemic, the gap has now widened again to 11 percentage points. Another striking feature is that the proportion of white students achieving top grades stayed steady at 94%, while the percentage of ethnic minority graduates achieving those same results dropped from 86% to 83%. When I analysed the data by ethnic group, it showed that an awarding gap persists between white graduates and those from all other ethnic backgrounds, and those gaps widened in all cases compared with our previous analysis.
And is there a similar pattern within other degree courses?
Yes, it's not unique to pharmacy. Following the pandemic, the ethnicity awarding gap for all UK graduates widened for the first time in 7 years, according to the latest report from the charity Advance HE. It's a hugely complex problem with lots of different factors involved.
It is. You've worked on several of our awarding gap features over the years. How do your findings this year fit in with previous years, going back even before the pandemic?
So pre-pandemic, when we first analysed the MPharm awarding gap, it was sitting at around 12 percentage points. Then, as I mentioned, during the pandemic, it dropped to 8 percentage points, which gave hope that progress was being made. Unfortunately, this year's increase to 11 percentage points feels like a step backwards, almost a return to pre-pandemic levels.
And what do you think caused that widening of the gap post-pandemic?
So during the pandemic, assessments shifted online, and this coincided with a noticeable narrowing of the gap. But since universities returned to in-person assessments, the gap has widened again. It could be that online learning offered more flexibility and less pressure than traditional exam settings, which seemed to benefit ethnic minority students in particular, but it might also be down to other factors.
Your feature mentioned that Black pharmacy graduates were particularly affected. Why do you think this group faces the largest awarding gap?
Yes, so for Black pharmacy graduates, the gap widened to 17 percentage points, significantly larger than other groups and even larger than it was pre-pandemic. Experts believe that this is linked to a combination of structural issues, including reduced access to mentoring, feelings of isolation, and a lack of tailored academic support. These factors can make it harder for Black students to achieve their full potential, even if they're highly capable.
These are pretty clear trends from the HESA data that we received, right?
Yeah.
But are there any important caveats we should bear in mind when discussing this topic?
Absolutely. The data doesn't account for other factors that can influence degree outcomes, like socio-economic background, entry qualifications, gender, and choice of degree. And in addition to that, ethnic minority students are disproportionately represented in pharmacy degrees, so they made up 73% of pharmacy graduates in the most recent data set, and that adds another layer of complexity.
Talk to us more about that. How does that 73% shape the conversation around the awarding gap?
So I spoke to Sean Brophy from Manchester Metropolitan University, and he suggested that discrimination and inequality within universities may only explain part of the problem. He hypothesised that differences in the proportion of individuals from specific ethnic groups entering higher education could also be playing a role. As I said, pharmacy has a much higher proportion of ethnic minority students compared to the overall university age population. And Brophy suggested that when certain ethnic groups are significantly overrepresented, it may mean that there's a wider range of academic abilities within that group, potentially making the awarding gap appear more pronounced. So research to understand whether that's impacting the gap among pharmacy graduates could be valuable.
That's certainly worth considering. In addition to our analysis, the Royal Pharmaceutical Society also published a report on this last year and has set up a working group tackling the issue, specifically for Black students. What are their key recommendations?
They're focusing on several crucial areas: improving assessment fairness, supporting students during the transition from school to university, and enhancing mentorship programs. They also emphasise the importance of better data collection to track the gap more accurately. The focus on mentoring and role models is particularly powerful because, as I'm sure you know, seeing people like you in leadership roles can make a huge difference in fostering confidence and ambition.
Yes, absolutely. Tell me more about how better data collection could help.
I spoke to a researcher at the University of the West of England, Emmanuel Adukwu, who stressed the importance of universities carrying out detailed data analysis and continuous monitoring to identify which groups are most affected. His view was that without this deeper understanding, universities risk applying generic solutions that may not effectively target the students who need the support most. He also highlighted the need for cross-institutional collaboration. In other words, pharmacy schools working together to share best practice, and ensuring these efforts are backed by strong leadership to create lasting change.
Okay, well, let's come back to that idea of strong leadership. So we've been talking about the national awarding gap. Did you look at the gaps within each of the schools of pharmacy as well?
Yes, I did. And similar to previous years, there's wide variation between schools of pharmacy in the size of their awarding gaps. However, I should highlight that in some schools, the magnitude of the gap can be influenced by just a handful of students awarded a higher class degree, because we're talking about such a small sample size. Regardless, there were plenty of examples of initiatives that schools have implemented over the past few years to try to close their awarding gaps. For example, Brighton University told me that it has an MPharm data group that meets regularly to analyse student performance data, enabling it to proactively identify gaps in student achievement and ensure targeted support for those students who need it. The University of Lincoln is working with their Equality and Diversity Institute to redesign assessments and improve student support. And the University of East Anglia has successfully implemented a Student of Colour Ambassador scheme, which is credited with improving outcomes. The University of East Anglia is actually quite an interesting one because it's reversed the trend. Its awarding gap now favours ethnic minority students, but only by about 2 percentage points, so the absolute numbers involved come down to just 1 or 2 students. But it does sound like the university is proactive in interrogating its data to really drill down into where the awarding gaps lie so it can take action to address them.
That's really interesting. What needs to happen now to ensure lasting change in closing the gap?
Well, as we've discussed, this is a hugely complex problem with lots of different factors contributing to the awarding gap. So I think there needs to be a system-level approach that brings together all stakeholders. The working group, led by the RPS, which includes the British Pharmaceutical Students Association, the General Pharmaceutical Council, NHS England and the Pharmacy Schools Council, is an important first step on this path to sector-wide change. I also think the RPS has an important part to play in advocating for change and driving accountability. It's that leadership role that we talked about earlier. Ultimately, it's about creating an environment where all pharmacy students, regardless of background, can thrive.
Absolutely. Thank you for keeping on top of this topic. It's really important work that you're doing.
No problem. And just to say, we'd love to share more examples from schools of pharmacy and students of initiatives that have been successful in closing these gaps. So please do get in touch.
Yes, please do. Thanks again, Dawn. This episode of the PJ Pod is part of our March issue. The PJ Pod is brought to you by the Pharmaceutical Journal, the official journal of the Royal Pharmaceutical Society. And just before I let you go, if you're interested in joining the Royal Pharmaceutical Society to access a range of member benefits, including the Pharmaceutical Journal's news, features, and learning resources, you can do so for the equivalent of just 60p a day. Just search RPS membership to find out more. Thanks for listening. Bye.
Bye-bye.